Morning everyone. So, ito ako, si Lemma, sa inyong harapan. I-discuss namin is about sa chlamydia and gonorrhea. Most lang, huwag kayong masyadong OA at huwag masyadong overreactive sa mga makikita nyo sa PowerPoint. Kasi be open-minded. Kasi itong PowerPoint na to is more like a sex education rather than sa biology.
Minsan ba, nararamdaman mong masakit o may unusual sa inyong vagina or sa penis? Okay, so let's talk about chlamydia. Chlamydia is a common STD that can cause infection among both men and women. It is caused by a bacterium called Chlamydia trachomatis.
Go.
How is chlamydia spread?
So, chlamydia, pwede yan matransmit. Alag, katawang na chlamydia is spread sa pakikipag-sex. Pwedeng male to male or female to male. Pwede siya sa vaginal or anal or oral sex. Sa puwerta, sa puwet, at sa bunganga.
How to reduce the risk? Even condoms can reduce your risk of getting chlamydia if used the right way every single time you have sex.
So, the surest way to prevent chlamydia is to not have sex. Or, kung makikipag-sex ka, doon ka lang sa bebe mo. Huwag kang makipag-sex sa mga bebe ng tropa mo. Huwag kang babaero or lalakero. Kasi, kasi dyan, loyalty rin yan. No?
It's commitment.
Commitment. So, sa lalaki, ang common symptoms ng chlamydia is burning when urinating, discharge from the penis, and pain or discomfort in the testicles.
Many people with chlamydia have no symptoms or only mild symptoms. If symptoms occur, they may not appear until up to 3 weeks after having sex with someone who has chlamydia. So, sa mga babae naman, ito yung common symptoms. A charging vaginal discharge, bleeding between menstrual periods or after sex, pain or discomfort in the lower abdomen, burning sensation when urinating. Parang sa mga lalaki din, pag umiihi, parang may feeling na mainit or burning. Yes, what feeling?
Pero, so yeah. So, ang treatment for chlamydia is thankfully, pwede siyang ma-cure with antibiotics. Siyempre, with your doctor, magpa-check up ka muna para alam kung anong antibiotics yung pwede. Pwede ito, like doxycycline,
Taken every day for a week and one dose of 1 gram. Followed by 500 milligram once a day for 2 days. So yung mga doktor na lang ang may alam dyan, yung pagpapacheck up.
So, chlamydia can usually be effectively treated with antibiotics. More than 95% of the people will be cured if they take their antibiotics correctly. So, guaranteed na makikita.
How common is chlamydia in the Philippines? At least 70% of male and female sex workers are positive for chlamydia without symptoms. And as many as 33% of newly diagnosed HIV patients have undiagnosed chlamydia. chlamydia in Philippines is unknown, but studies done in certain hospitals and social hygiene clinics have demonstrated.
So, meron pang isa which is yung gonorrhea. Gonorrhea is sexually transmitted pain, also called sexually transmitted disease, caused by bacteria. Sexually transmitted diseases are infections spread mainly by contact with genitals or body fluids.
Ang gonorrhea, STDs, STIs, or venereal disease, sexually transmitted infections are caused by bacteria, viruses, or parasites. Gaya nung Neisseria gonorrhoeae bacterium, yun.
Sa male, pwedeng painful urination ulit, most like discharge from the tip of the penis, and pain or swelling in one testicle. Diba yung penis natin, meron yan yung ulo, katawan, at yung dalawang loob. Sabi doon, pain or swelling in one testicle. Pag yung isa mong itlog is masakit, you can either go to a doctor para magpa-check up ka rin. Kasi that can be a sign.
So, sa mga babae naman, increased vaginal discharge, painful urination, vaginal bleeding between periods, such as after vaginal intercourse, abdominal or pelvic pain. So, pag nireregla, di ba masakit sa puson? Pero, if di ka na nireregla, tapos nakaranas ka ng ganito, abdominal or pelvic pain, pwede siyang sign na meron kang gonorrhea. Causes of gonorrhea. Gonorrhea is caused by the bacterium. The gonorrhea bacteria are most often passed from one person to another during sexual contact, including oral, anal, or vaginal intercourse. Yun yung tinatawag na sex.
So, complications of gonorrhea. So, ang mga babae pwede maging infertile, pati rin yung mga lalaki. Infection that spreads to the joints and other areas of the body. Increase ang risk ng HIV or pagkakaroon ng AIDS, and complication in having babies in the future.
Prevention of gonorrhea. Don't have sex with someone who appears to have a sexually transmitted infection. Consider regular gonorrhea screening. Regular screening also is recommended for men who have sex with men. So, sa lalaki at lalaki. Their partners also should be tested.
So yeah, use condom if you have sex. Limit your number of sex partners. As possible, be loyal to your partner when it comes to
Isa lang.
Isa lang. Tama na yung dalawa. Ay, tama na isa. Be sure you and your partner are tested for sexually transmitted infections. Or monitor yourself kung meron kang mga symptoms. Pag meron, huwag nyo nang ito. Kasi makakanta lang may insect. So yun, ulit-ulit. Condom, limit your number of partners, don't have sex if possible.
Gonorrhea of 1%. How common is gonorrhea in the Philippines? Gonorrhea of 1%, chlamydial infection of 5%, trichomoniasis of 1%, bacterial vaginosis of 10%, syphilis of 1%, and so ano ba yung
Ano yung pinagkaiba ng
So, how common is gonorrhea in the Philippines? The sample size for women recruited was calculated based on the following estimated prevalence rates.
Chlamydia and gonorrhea are both sexually transmitted infections. They share some similarities and have overlapping signs and symptoms, but they are caused by different bacteria. Chlamydia is the most common sexually transmitted